Hey y'all, today I want to go over some of my favorite strategies for alleviating knee pain. Now, the first thing I always like to look at is if there is no trauma with our knee pain, if they just kind of came up seemingly out of nowhere or with our training, but not with some sort of injury to our knee. First thing I want to look at is programming, of course. Do we progress our intensity or volume of training quicker than we should have? And if we can adjust that, that's the first thing to do, as well as looking at our sleep and our nutrition and our recovery habits, and can we fix those and optimize those. But let's say we've got all that on point. Maybe we're training for a race or something like that, and we can't necessarily take extra time off to let our knee calm down. Here I'm going to show you some of my favorite strategies to calm down the knee in between training sessions so that we can continue to train without taking too much time off. Okay, y'all, so my first favorite exercise to help with some relief of knee pain, this is specifically going to help with joint pain the most, is called the tailgater. So I'm sitting ideally with my feet elevated off the floor, so I'm using my table here, but a bed could work, even a chair. You don't have to be elevated like this, but I think it works best. And we're just getting a nice easy swing of those legs back and forth. Okay, so nothing aggressive, nothing super hardcore, but just some nice easy leg swings. I can add a little bit of rotation by going in some circular motions here and getting those legs to move, but essentially we're just giving a little bit of distraction to our knees and a little bit of unloaded motion, okay? And joints like unloaded motion. You could also do this with a bicycle, right? A stationary bike is fairly similar if you drop the seat down and you're getting some movement on the bike. Again, nothing super aggressive, but I like the tailgaters. Doing this for 3 to 5 minutes can be helpful. You can add a little bit of an ankle weight even to this, and that can give a little bit more distraction, and that can be helpful as well. But yeah, the tailgater, first one. Okay, y'all, my next go-to exercise for knee joint pain is called the McKenzie extension exercise. And so the idea with this exercise is you're getting a little bit of distraction to the joint. Again, you're getting a little bit, if I have my knee joint here and it bends this way, I'm getting a little bit of opening and separation on the knee joint. And so this is how you do it. I'll put you guys down at knee level here. Okay, so you're sitting in a chair, you have your leg extended, your knee is straight and relaxed, unweighted at first. And I'm going to apply a force that's perpendicular to my thigh with my hands. I'm going to come right above the kneecap, apply some force, so take the slack out of the knee, and then I'm going to pulse 1, 2, 3, and relax. And take that slack out and pulse 1, 2, 3. And I might do that 10 times. Okay, I'll come in here and push on it and just give a little bit of that pressure on the knee. Okay, y'all, piggybacking off our last exercise, which was the extension exercise with overpressure, where I'm taking my extended knee and applying that downward force to open up the back of the joint. This one is a flexion-based exercise to open up the front of the knee joint, okay? Usually one or the other of these will feel better, and so, but you can try both. This one just takes a towel, a small towel. I like to do this laying down, but you could do this kind of in a child's pose position as well. But laying down, I kind of wedge that towel behind my knee, and then I'm using my hand to actively bend that knee, okay? And what's happening is this towel is kind of pushing the tibia forwards relative to the knee joint, and it's called a knee distraction technique. This one you could hold. I like to pulse in and out of it, just like with the extension exercise. Give it a try. Okay, y'all, so we've gone over a couple exercises for the tibial-femoral joint. That's the knee joint proper. But sometimes the knee pain that we're feeling is actually coming more from the kneecap, okay, and the patellofemoral joint. And some of those techniques that I've already shown you can help with that type of pain as well. But something that's really helpful for this is patellar joint mobilizations. And these are really simple to do. I will go ahead and demonstrate them for you, but you want your knee to be extended and relaxed, okay? So not flexing the quad, but relaxed. I'm gonna cup my hand around my patella here, or I can just kind of go on the poles of the patella here, and I'm just gonna push it side to side and push it up and down, okay? Sometimes we can take it and kind of twist in a circular motion. What we don't really want to see, if my hand is my patella here, is we don't want it to be tilting, okay? So sliding up and down, side to side, circles, but that tilting can cause more rubbing. So you want to kind of keep it level as you do this. Keep your thigh relaxed and moving up and down and side to side. And just spending a few minutes mobilizing that kneecap can also feel good and be helpful if the pain is coming more from the undersurface of the patella. Okay, y'all, so hopefully you've gotten some relief from some of the joint related techniques that I've shown you so far, but maybe not, and that might be suggestive that you have more of a contractile tissue issue, which would be more of a tendon related pain or tendinosis, tendinopathy, tendinitis. These are very common, and I find that they're actually commonly underdiagnosed. And the exercises that I like to use for tendon-related pain or tendinopathy are called isometric exercises. So this is just flexing the muscle and holding that contraction. That tendons like to be used in that way with some tension. They don't like stretching, they don't like compression, but they like tension. And so the first isometric exercise is called a quad set. So I'll show you that. So here, I'm just going to extend my knee and have it nice and straight. Bring that down a little bit. And all I'm doing is I'm contracting the thigh, okay? Contracting, holding this. If it's really irritated, maybe I'll do 5-second holds. If it's feeling okay, I like to do 30 to 40-second holds. And either way, I like the amount of contraction time to add up to 100 to 120 seconds. So if I'm doing 30-second holds, I'll do 4 of them. If I'm doing 5-second holds, I'll do 20 reps. So sometimes that quad set exercise I showed you in the straight knee position doesn't really get to it. Sometimes it's actually irritating in that straight knee position, and our knee tolerates it in more of a bent knee position. So here is a way to do an isometric exercise with a bent knee. So I'm going to do it sitting in my chair, and I'm going to use my bed that I have here as a resistance for my foot. Okay, and so I'm actually going to put this down here so you can see that. So I'm going to hook my foot underneath the bed frame here. It's not going to feel very good on my foot, so I'm going to use a towel on top of my foot, place that underneath the bed frame, and I'm basically going to try to lift the bed up with my leg, right? I'm going to kick into that bed, and I'm going to hold that contraction. Now you can do this into a wall, you can do this into a desk. I used to do this into the dashboard of my car. But essentially you want something that's got enough resistance that you can kick into it with a solid amount of pressure. And same as the last exercise, I might do 5-second holds if my knee is pretty irritated, building up to 30-second holds if it's only mildly irritated, and trying to get to that 100-120 seconds of contraction. Okay, the last 2 isometric exercises that I have for knee pain are in a squat and a lunge position. Okay, so I'll show you both of them really quickly. These are a little more tiresome, but they are also really effective. So the first one is in a squat. So I'm coming up, I'm going into a squat. I'm not in a super deep squat, okay? I'm mostly working on knees. I'm not working on really getting deep into my hips. So just a little bit of knee bend. I'm gonna hold that position and I'm gonna come up into a calf raise, okay? Now, don't ask me why we do the calf raise. It's just to distract you from the fact that you're holding an isometric knee contraction. It's kind of boring to just sit here in a knee position, but you could just sit here, but I like the calf raise. And similarly, with a lunge, you can come into a lunge position and be doing a calf raise. So from the side, I'm in a lunge, holding that knee position while I do a calf raise. And this gets fairly tiring, so I might do 5 repetitions and then come out of it. And maybe 5 sets, something like that. But yeah, isometric squats and lunges with a calf raise. Okay, y'all, there you have it. Those are some of my favorite pain relief strategies for the knee. Again, in addition to these strategies, which are going to give you some short-term relief, they're not permanent fixes by any means. Adjusting our programming and making sure our nutrition and sleep and recovery habits are on point are key. But if we're training for some sort of race or competition or something like that, and we don't really have the ability to reduce our training load, then these are some things that can help feel better in the short term. So we had the tailgater and the egg beater, where we're just getting some nice unloaded motion of the knee. A stationary bike for 15-20 minutes at a low intensity where we're a little lower and getting the knees to bend and not be up high where it's the hips can also help with that. We did the knee joint distraction techniques, both the extension technique where we're pushing into overpressure, or the flexion technique where we had the towel for some distraction. Can be helpful. We had the patellofemoral joint mobilizations for kneecap pain, and then we had a series of isometrics, both a straight knee quad set, a bent knee quad set, isometric squats, or isometric lunges that can all be helpful for any number of knee pain issues, but specifically helpful with tendon related pain. So I would give those a try. See if a couple of them give you relief. Certainly you don't need to do all 7 or 8 techniques, but if you have a couple of them that really feel helpful, I would do those a couple times throughout the day on your rest days or between trainings, and see if that helps. All right. Good luck. Guys, I decided to throw in a little bit of bonus footage here talking about what to do if you're having knee pain while working out. So everything I've talked about before was mostly more what you might do after a workout or in your recovery time. But let's say you need something quick to help relieve the pain while you're doing your workout. So the 2 techniques that we kind of discussed that I would say have the quickest turnaround if they're going to help are the knee extension with overpressure. So just I'm working out, oh, my knee's bothering me, stretching out that knee and getting that downwards backwards pressure and kind of pulsing into it. Okay, that one seems to give some pretty quick relief. Or our isometric lunge, so holding that lunge. If you have the ability to add the calf raise is nice. Those are the first 2 that I would try. You can also look at, if you're running and having some pain, you can try shortening your step length, your cadence, and increasing your cadence for a little while. You can try going into some shuffling for a little while. You can go into some backwards running. Just changing the stress that you're putting on the knee for a couple minutes can allow you to continue down the road and maybe give a little bit of relief for the knee pain. But that's all I got.